Greetings from the Department of Neonatology here at Manipal Hospitals in Bangalore. I have the proud privilege of introducing my erstwhile colleagues, Dr. H.A. Venkatesh, who is a consultant neonatologist, very senior in the profession for the last 20 years, who's been with us here at Manipal Hospital, Bangalore, and a young consultant in neonatology, Dr. Rajat Pejalwar, who's been with us for about 2 years now. The Department of Neonatology and the NICUs here at Manipal Hospitals has had the distinction of being one of the earliest level 3 NICUs in the country in this part of the world. So much so we have a reputation which is very formidable this last many years of delivering excellence in clinical care, doing the most advances of neonatal care practices ethically and professionally. But we are very proud of the fact that we are one of the most well recognized academic neonatal units in this part of the country. It's been more than about 3 decades we have started the pediatric training program in our department, and more than 16 years since we started the National Board 3-year neonatal training program in super specialties of neonatology, and more than about 13 years since we started neonatal fellowship programs. But what we are very, very proud about is this last 8 years, my colleague, Dr. H.A. Venkatesh, who is a very senior neonatologist and a highly acclaimed neonatal ultrasound and functional echo specialist, he has curated out a very well-known program now, which is very popular amongst neonatologists in this country, of training students who have done neonatology already in the nuances of ultrasound, particularly echocardiography, ultrasound of the brain and the rest of the body organs, including point of care lung ultrasound. About 8 years back, Dr. Venkatesh got on to this kind of program of training neonatologists at point of care ultrasound. The program is called OASIS, which he'll explain to you more about, where point of care ultrasound is being used as a technology screening, mostly in the NICUs, to help the clinician as an extension of their clinical tool to see how best they can care for their babies better. More than 30 students have now benefited from this program, and they're all senior and respected neonatologists practicing elsewhere in the country. So I have proud privilege of introducing this program through Dr. Venkatesh. Dr. Venkatesh is going to talk about it.
Thank you, sir. So, as rightly said by Dr. Karthik Nagesh, this is a program dedicated to neonatologists, especially who are working bedside. It's a bedside program. It is not exclusively for bedside as a bedside clinical examination, not for practicing. This cannot be practiced outside the NICU. It is only bedside as an extension to physical examination. We all know that clinical examination is very, very important, and as an objective looking of these babies, especially sick babies in newborn intensive care unit, started this program 8 years back with the name given to that, functional echocardiography and neonatal ultrasonography. But now a bit of change has been made, because just focus is only to look at the baby objectively, called OASIS program, which is actually called as Objective Assessment of Sickness in Neonates using sonography. This is very, very important, and this is to make sure that we give quality care to the baby. At the end of the story, we have to have a quality program, and it is a non-financial program, and it is not burden to any parents actually. This is just an examination, and with that, I already around 20 to 30 students have gone out after finishing this program, and this first batch, I am very happy to introduce 3 first batch OSIS candidates, Dr. Nirmal, Dr. Vikrant and Dr. Nikita. They have successfully completed this program, and it's a 3 months program. It's not 1 day or 2 days program. It's a 3 months, and it is hands-on program. Very, very important. Most of the time you cannot learn this just by online. You have to hold the probe, you have to align, you have to rotate, you have to tilt, you have to sweep. This is very, very important, and I hope that they are learned and they are here, and we also want them to talk about this program, how they felt it, and it is only the essence of this get benefited and do good for the babies. With this, I finish, and also I welcome Dr. Rajat Pejawar and to give some of the important words which is very important to the young neonatologists.
Thank you very much, Dr. Venkatesh, Dr. Karthik. I'm just very happy that senior neonatologists have actually embarked on this difficult journey of actually training neonatologists in the art of bedside echocardiography, cranial ultrasound, or point of care ultrasound. It just emphasizes the fact that the field of neonatology has been evolving every day, and probably in the last 10 years the focus has been on point of care ultrasound. A lot of evidence has shown that it helps in the early diagnosis, and it's an extension of your clinical examination, helps you confirm your clinical findings and possibly to initiate therapy or treatment faster. And you can even do this regularly and see the effects of your treatment and see whether the baby is moving in the right direction. I think point of care ultrasound is something that all neonatologists should train themselves in, whether it's the ultrasound of the brain, heart, lungs, intestine, bladder, vascular access. I think any part of the baby can be visualized through ultrasound, and it has immense value. So I hope more and more people come, get themselves trained. I think this 3-month program is something that is going to benefit a lot of neonatologists, and I hope they all continue to use this. Thank you.
This is a kind of flagship program which has been initiated by Dr. Venkatesh, which is like an icing on the cake, and to fine-tune the clinical abilities and the point of care ability, assessment abilities of a practicing newborn intensivist. We really feel proud to introduce this program, and a current batch of 3 budding neonatologists who are going out and starting their practice. We feel proud to have had them trained here, and I wanted therefore Dr. Nirmal Gautam, he is going to talk about what he learned in this program.
Yeah, hello everyone. So I'm Dr. Nirmal. I've been part of the super specialty training program at Manipal for the past 3 years. So I would be saying very frankly, when I joined the department, I was not aware of much of the neonatal ultrasound and the functional echocardiography. So gradually I used to see Dr. Venkatesh sir and our teachers doing ultrasonography. So there the interest developed. As a part of the super specialty program, nowadays we are supposed to know the basic knowledge of ultrasound and the functional echo in the neonates to take care of the newborns as better as we can. So gradually by seeing and learning, then because sir was having this training program, structured 3-month teaching program in this ultrasonography and functional echocardiography. So we had that fortune to train under sir, and I would say that it's a program which is very well structured, and it's a very personalized program because sir has almost held our hands and made us learn. So thank you sir for that opportunity. And as compared to the point where we started, I would definitely say we feel more confident in doing various ultrasounds in the newborn and doing the functional echocardiography as well, and definitely it has helped us a lot. Thank you so much.
Thank you. Thank you, Nirmal, for that wonderful feedback. We hope to continue this program for benefit many younger generations of neonatologists with us. Dr. Nikita is our 2nd year National Board Super Speciality Trainee in Neonatology. Nikita has already undergone this course. Dr. Nikita, will you just make some comments, please?
Hi, I'm Dr. Nikita. I'm the 2nd year DRLB trainee in Manipal. I am very happy to be part of this stream of neonatologists here, and I got an opportunity to be part of this OASIS program. Though I have done some 2 days and 3 days courses before with hands-on and theory courses, but they were never anything like this unless and until we hold a probe and do it on the babies and practice and more, it is of we don't get the confidence if we do it for only a smaller period of time. And definitely this 3 months which sir has taught us has given us much more confidence in functional echocardiography and ultrasonography, and in diagnosing various emergency situations in the newborns. I hope that this program continues and more people get trained, and it will help us in future for us to practice in the field of neonatology. Thank you, sir.
Thank you, Nikita. That's very nice. And the other person, of course, who's now finished his 3-year program with us in neonatology is Dr. Vikrant Balote. He's going to give his views on this program, please.
So, with the advances in neonatology, point of care has become the cornerstone, we must say. And with this course, it has been very impactful difference in management of critical neonates. So, we have been learning hemodynamics, ultrasound, cranium, and all the essential screening tools that are required at the bedside. So I feel this program OSIS has helped us. Dr. Venkatesh and Dr. Karthik and Dr. Rajat have always promoted us and always guided us well in this curricular course of us, and I feel that the course is really important as a latest advances in the neonatology. And thank you.
Thank you, Dr. Vikrant. I must really once more congratulate Dr. Venkatesh, because I myself have been seeing him develop his clinical skills in the field of neonatal ultrasound. It takes a lot of effort and a lot of dedication bedside to do it and learn it. I may tell, probably as been pointed out earlier also by my students, you may do multiple workshops, attend workshops or online courses, but dedicating oneself to bedside, doing it yourself and being handheld with people like by Dr. Venkatesh, people like him, is very essential. The most important thing in any organization is the senior management supporting us for many of these courses and what we have done and achieved in this last 30 plus years since I've been a neonatologist at Manipal Hospital, Bangalore. Our senior leadership has been very supportive of academic inputs and about academic progress. And this course has been seeing the light of the day only because of the fact that our senior management has supported us. We were one of the first ever institutions in this country to get a bedside ultrasound dedicated for the NICU in our department, more than 6-7 years now. And ever since then, we have always encouraged our fellows and trainees to use this ultrasound. And this particular program, when it was curated out, well, not now, 8 years ago, the senior management gave us the opportunity to be labeled under even the Manipal University, and the course was initially given the go by our senior management. I'm very thankful to the senior management. Currently, Dr. Manish Rai, Dr. Vasundhara Atre, they are the people who are propelling this course, and I'm very thankful to them.
On Dr. Nirmal Kumar Gautam, who has successfully completed the OSIS course held in Manipal Hospital, Old Airport Road.
Hearty congratulations, Nirmal. Wish you all the best. Do very well. And
next candidate who has successfully completed the OSIS course, Dr. Vikrant Pradeep Balote.
hearty congratulations, Vikrant. Do very well. Wish you all the best. Just
Thank you, sir.
So our third candidate who has successfully completed the OSIS course, Dr. Nikita, please come ahead.
hearty congratulations, Nikita. Wish you all the best. God bless you. Continuing doing more OSIS during our training next 1 year here, so that you help us get
Thank you.